Vicky and Greg, I'm so happy and thankful for give us the time for this interview. And that's so great. Thanks a lot. And I would like to ask you directly, would you like to introduce yourself, please?
Well, I think we can do that, and I'll go ahead and start. Thank you, Kitty, for inviting us to do this podcast with you. We are excited to be able to share our history with PNF and hopefully the future to some degree.
Great.
I'm a graduate of the University of Southern California in Los Angeles in 1971. While I was there, I got to be taught by one of Maggie's uh, people, PNF. And so Ardith Williams was the one who came in and did teaching for us.
Great.
After that, I really believed that PNF was something that I wanted to learn. And after we got through with all of our clinicals, Maggie got a hold of Margaret Rood of the Rood technique
Yeah.
and said she had three residency positions opened up for January 1st, which was coming up very soon. And all of us put our names in a hat, and I was very lucky to be one of those three to be selected. And so on January 1st, I made my way to Vallejo, California, and joined and got to meet Maggie. And I can tell you that I had, up to that point, started considering not being a physical therapist and going back and doing something else. My clinicals and times did not inspire me. I didn't feel like this was really the profession that I was meant to be in. And we got in that year, and on that Tuesday, Maggie did a demonstration on a hemiplegic patient.
Great.
And everybody helped this older lady get up on the table, and Maggie came in and within 20 minutes had her able to stand on her leg and take a couple of steps.
Wow.
And I sat there and I said, wow, I am inspired. And I never again thought about leaving the profession. That was the day that changed my life, was seeing this woman do magic. And
Great.
I got to spend close to 7 years there. Actually, it was 6 years there. Uh, and during the time I was at Kaiser Vallejo, within almost a year after I was there, Maggie asked me to start teaching because Pat Payne, who had been her assistant and who had was teaching three of the courses in the PNF coursework, uh, had to leave, and so Maggie put me into the classroom. And so, starting in my second year out of school, I started being able to teach PNF and work with Maggie. And during those years that I was with her, she never failed to inspire me, to encourage me. So much of what I feel like I have accomplished in my 54 years of being a physical therapist, we're all built on the foundation of Maggie Knott and PNF and her inspiration in my life. And
Amazing.
so while I was at Kaiser Vallejo, I got to be there for my last month of January of 78, and Vicky came in during that last month and was with the new class. And so that's how I met Vicky. In fact, if it hadn't been for the fact that Maggie came to me and I was supposed to have my last day on December 31st and asked me to stay one more month to just help her out, I don't know that I'd have ever met Vicky, and I don't know that we would have had uh, all these wonderful years together.
Destiny,
And,
destiny.
and
Great.
so we got to meet each other. At that point, I had been teaching PNF courses in various different locations around the country that Maggie had helped me set up. So we were starting to do the continuing education courses. And so Vicky shortly after started joining me, and we started teaching PNF together, and started developing other coursework, soft tissue work, and functional mobilization. And at that point, Vicki and I developed the Institute of Physical Art, through which we have been teaching now and presenting courses and developing faculty. And we've trained over probably 50,000 physical therapists so far through the Institute.
Amazing. Wow.
So
Wiki.
my story, oh, I'm sorry.
And so at this point right now, I am ending at the end of August my clinical practice, and will be retiring from clinical practice, but continuing to teach and mentor our fellows and our residents that we have in our clinics.
Great.
So
Thanks.
my introduction to Maggie, very much destiny and very much magical, as I like to say. My experience was a little different in that while I was in PT school, the director of my neuro was best friends with Maggie and with Berta Bobath and Milani and a few of those other people that they were all hang out together. And Maggie used to come to our school every other year and teach our seniors. Well, the opposite year that she would come, that class would get to watch all the videos. So my class was the one that got the videos, and I became entranced with this woman after watching about 20 hours of her teaching and treating, and requested to go to one of my affiliations based on my love of what I'd seen with Maggie. And it just so happened that the person that opened it up for Greg to begin teaching at Payne was the director of the program where I went for my affiliation.
Great.
And my magical moment happened in an in-service the first week I was there. And she brought in a incomplete quad and laid this quad on the table and said, I want you to roll over. And of course, I'm a student going, why would she ask this quad to roll over? Why would she do that? That's just not very nice. And Pat proceeded to do the technique of repeated stretch from the beginning of the range.
Yes.
And within 5 minutes, a patient who couldn't even move their leg began to roll.
Wow.
And I was just like, okay, this is it. I'm going to Kaiser. So I called up Kaiser and they told me, oh, we're so glad you're applying, but there's a 12-year wait list to get in. And this was 1977. So I'm pretty persistent, and I kept bugging them, even scheduled my last affiliation to be in California so I could go personally and bug them. And it was a cancellation of a foreign student that could not get their visa approved at the last minute that allowed me to get into the program January 1st of 1978. And I've never looked back. And
perfect.
That woman's passion for changing patients' lives, and as we always quote her saying, the belief that every human being has existing potential, shaped everything that Greg and I have done since. And she is the inspiration for us. And I'm so thankful for what you're doing, Kitty, because there's a trend in our world of physical therapy to not remember and acknowledge the giants upon whose backs we stand. And Maggie is very much a giant in our profession. And the more we understand today about how brilliant she was through our current knowledge of science and everything, the more we should respect and look back and remember her and thank her for what she did when she and Dr. Cabot put together proprioceptive neuromuscular facilitation.
Yeah, right. Absolutely right. And this is one of the reasons why I'm saying we have to do this work to really keep her in our mind, especially for the young colleagues. And I memorize her all the time in my courses and saying, this is the reason why we are now here all over the world coming together. That's so great. Yes. Would you like to talk about a little bit what you remember the most when Maggie comes in your mind? Both of you. Is there any special story or any special outside of this terrific, great treatment?
Well, I'll share a personal story.
Yes.
Maggie was from the South in the United States.
Yes.
And when Greg and I started dating, she told Greg very early on, after when I had her over for dinner and made her fried chicken and turnip greens and all that, she said, "You're going to marry this woman, Greg." And so I always felt like our relationship had her blessing. And
Great.
I think just she knew, and that's just the kind of woman she was. She was just always giving of her heart and her kindness and her love. But I also remember the woman that would stand with her arms crossed and stand over me while I'm working with a patient on the mat, trying to get them to roll. And she would keep saying, "If you don't get the trunk in the first 2 degrees, start over." Now, I would sit there and go, "Am I supposed to pull out a goniometer? What does she mean, the first 2 degrees? I don't understand what she's saying." And now we do. Now,
Right.
all the science and research in the mid 80s and the 90s teaching us what core for strategies are.
Yes.
Maggie knew this through her hands. She didn't need someone to tell her that there's research that tells you the core should fire before we move our extremities.
Mm-hmm.
She knew that. She just couldn't express it in our current terminology because that terminology wasn't available. But she knew what we needed to do. And that will always stick with me, is how her insight, her pattern recognition guided what she taught.
Yeah. You know what the title from our AGM this year will be in Budapest?
No.
Call the core for better life.
I
This
love
fits
that.
so great to your story. Thanks. That's
Yes,
amazing.
it is. And everything we teach in PNF, the entire basis of our PNF is to facilitate the coordination of the trunk core with
Yes.
extremity motion.
Yes.
Everything we do. And Maggie knew that and
Yes.
taught us that, and now we understand it.
Mm-hmm. And because of your personal story comes in my mind, she really lived this, see the whole human being, right? She has the feeling from your emotions and she could feel what's going on. So this is really great to hear this. So thankful, Sarah. Greg, what about you? What comes in your mind? Do you also have a special story?
Well, I'd have many because in those 7 years, there were so many different times, particularly watching her teach and seeing how she'd impart information.
Yeah.
Having her take a patient that was complex and see her problem solve, see her go in and figure out what to do. But more than anything, watching her personality facilitate that patient to do more. She had the intention to make a difference. She taught me what it was like to absolutely intend to get results without the fear of failure. And that was a very important part for me.
Yes.
Also, being able to see how she would interact not only with the patients, but all the staff that was around. So there were lots of lessons that I learned from her. But I would say one of my personal ones was in the beginning, she so intimidated me that I would tend to go hide away from her and not around her. I was more afraid of her wrath of me not doing something right than I was wanting to learn.
Yes.
And it wasn't very long after I'd been there, maybe 3 months, that she pulled me aside and said, "Greg, you got to stop this hanging out around where I can't help you. Let me help you and let me help you to become as good as you can be."
Great.
And it was that day that I really changed that whole approach of fear of failure being top of my list and the passion to become the best I could be. And she helped to facilitate that. So
Absolutely.
for me, that was a turning point in my life, was her challenging me to get over my fear of failure.
Yeah, that's good. Also, motivate and show your hidden potential, right? She
That's
was
right.
Exactly
able
right.
to really go in and put it out from the therapist. Yes. And I also learned from Aya Feyenchik. She's the model on the videos in Switzerland, Bad Ragaz. She was also one of my instructors. And even some videos from her look a little bit rude and tough. She was all the time saying the hands were so soft. This is what I try to explain the participant when they see the old videos. It looks not like it feels at that time, right? You
Yes.
both could feel the
Yes.
hands of her, right?
Yes.
Yeah, yeah,
And, I think you've just approached a very delicate subject. And I don't think the emphasis is placed enough today on new therapists having the skill of touch.
yes,
And I know in our PNF class that we spend the entire first day
yeah,
just working on how to touch, how to hold a segment, how to feel the connection between your hands through
yes,
that segment, how to allow the patient to invite you in to their
yes.
body, how
Great.
to, when you have a patient that can't communicate with you, how to allow their brain to invite you in by being soft and gentle.
Yeah,
And you're right. I think there's sometimes such a rush to just do something
yeah,
that therapists forget that there's a process of becoming one with the patient through our hands.
yes,
That's what Maggie did so well. She laid, whether it was on a patient, an infant, even an animal, she could lay her hands
yes.
on that person or that
Yeah.
animal, and she became one with that body and
Right.
was able to get it to do what she wanted it to do because she sensed the response.
Yeah.
Instead of trying to do something to it, she was able to work with the system. And
Yeah.
that
Great.
is the most precious gift that I got from
Mm.
Maggie as PNF has been the foundation of everything, despite thousands of hours of Con Ed in other areas. The PNF is always my foundation. I tell my students is because that's how I connect with the human body is
Great.
through the PNF.
Hmm.
Yes.
Yeah. I love the sentence Sami Molcho was saying, the skin of a human being is the glove of the soul.
Oh,
So,
I
and
love that.
yes, and if you imagine this, then when you touch a person, it's not only that you touching the skin, it's really touching this human being. So see the whole human being. Yeah, I'm also totally with you. That's so great. Perfect, perfect, perfect. So, and what we also mostly asking, you give already very nice ideas and advice, but you are still teaching, and I also ask mostly, what is your important advice to young colleagues, to young PTs? What would you say as the most important part in your point of view?
You go
Uh, that is a hard one to filter down to one thing.
Of course.
I would say that a lot of it depends upon developing within yourself that intention to become the best you can be.
Yeah.
Uh, that intention is something that Maggie had.
Mm-hmm.
But also with that intention, not let it become so uh, deep within you that if the intention doesn't manifest itself, that you're impacted by a negative response.
Yeah.
And talking about a story of Maggie, I'm going to actually share one of the most powerful ones that happened to me is that I would watch the schedule for any time Maggie was treating a patient, and
Mm-hmm.
I would move my patient to lunch or after work or anytime I could move him so I could be there and watch Maggie treat. In fact, she I think, started thinking that I never worked because I could always find a way to be there. But for me, seeing somebody do something is what helps me to become better. And
Yes.
watching Maggie was essential.
Wow.
On this day, she had two patients back to back.
Mm-hmm.
And those two patients, the first one was a young girl with scoliosis. And Maggie actually did a pattern on her that set her off into acute spasm
Oh.
to the point that she had to call the emergency room and
Oh.
have this patient brought down to the emergency room in pain. Now,
Okay.
I was in such shock watching this
Mm.
that I don't think I could have treated a patient.
Yeah.
But Maggie handled the situation. She got the right things done. And the next patient was sitting there in the hallway and had observed this happening. And she immediately took him in. He was a very famous person in the United States, and took him into the treatment room, and I got to watch her do magic. And she treated him. She was able to focus on him. And that story to me resonated for the rest of my life. For those times when I didn't get the results that I wanted, or even had somebody that didn't respond well,
Yeah.
I had to learn how to be a professional like Maggie was and be
Yes.
able to go to my next patient and give them 100%. And
Right.
so, for a young therapist, you've got to learn to be a professional, which means you've got to be able to accept the successes and failures so that you can always be in a mode of learning from your failures and learning from your successes. And the other thing is just don't let your ego get in the way. Maggie had a very strong personality, but she was not egotistical about her skills. She
Great.
was always open to learn.
Wow.
And and I look to what Maggie felt was important, and that was that it takes time to develop our skills. This is why
Yes.
she developed the entire program at Kaiser, was because she wanted to give those therapists that were passionate about pursuing mastery the opportunity to really fully immerse in something and allow our own motor control, our
Yeah.
own motor learning to take place,
Yeah.
and more importantly, allow our pattern recognition. And again, if you go back and place Maggie's program in the context of history,
Mm.
she's teaching in the 50s, 60s, and 70s. We don't really use the terminology a lot of motor control, motor learning. There hasn't been a lot of research in that area in the
Yes.
50s, 60s, and 70s. We don't even, as an organization or in the world of science, understand the application of pattern recognition to physical therapy. That came about in the 2000s.
Mm-hmm.
And yet Maggie understood what it took for people to learn to create that program. And I think that it's important for young people today to, number one, if you're really passionate, you
Yeah.
need to find an avenue that allows you to fully immerse yourself in the process of learning. And you need to find an avenue that allows you to do that. And as Greg said, allows you to fail. Because when you study the definition of pattern recognition, it's a four-step process. And the fourth step is failure. And
Wow.
too many therapists are afraid to fail, and therefore they never learn how to recognize what they could have done differently. And
Right.
so I just would encourage, my encouragement to young therapists today is these are your magic. These are your
Yeah.
magic.
Yeah.
And whatever you need to do to, as Greg said, humbly continue to try to challenge yourself
Yeah.
to grow your skills using your hands and your heart as well as your mind.
Great.
We like to quote a sissy and say that someone who works with their hands is a laborer.
Yeah.
Someone who works with their hands and their mind is a craftsman. But someone who works with their hands, their mind, and their heart is an artist. And this is
Great.
why we call ourselves the Institute of Physical Art, because we don't want to lose the art of physical therapy, the
That's so
skill
great.
of our hands with the knowledge of our mind combined with the passion of our heart. That's what makes a great physical therapist.
Oh my God, so great, so great. Thanks a lot. This is really so good. And I'm saying also all the time, from the mistakes we learn the most, right?
That's right.
And our philosophy, when we really live this is really amazing. Yeah, I'm so happy. And that you take your time and please feel free if there is anything you like to tell to the out world for those who are not joining you still in your courses. But from now we will advertise this. This is amazing, and I hope I can join in a while also. It's so great.
It'd be wonderful.
Well,
Yeah.
I think I would like to just share that we need to view the principles of PNF.
Yeah.
A lot of people involved in research today only want to look at a technique. They
Yeah.
only want to evaluate, does this technique work? Therefore, does PNF work? PNF, Maggie, especially Sue Adler. Sue Adler
Yeah.
was always say this: PNF is not a technique.
Right.
PNF is an approach to patient care.
Yes.
And she was so right. And it's the principles of PNF that not only are timeless, but the more time that goes, the more science helps us to appreciate the critical importance of those principles.
Yes.
Even the name, the very fact that Maggie named proprioceptive neuromuscular facilitation, that the first word was proprioception.
Yes.
Our knowledge today between the sensory and motor homunculus helps us understand how critical proprioception and kinesthetic awareness is to movement. And Maggie and Dr. Cabot knew that.
Yeah.
But we need to embrace that. And so much about what we do with PNF enhances the proprioception and kinesthetic awareness that is imprinted on the sensory homunculus and guides the effectiveness of the motor homunculus to better our motor control.
Yeah.
And I just encourage people to think not only that, but now that we understand the genetic evolvement of our core and how that's so driven by our DNA, that core is not just something you create, it's there in our genetics. And everything that Maggie did, every pattern that Maggie used was extrapolated from our normal growth and development to enhance our core for strategies.
Yes.
And this is the power of PNF. And until you've really felt it, till you've put your hands on a patient and really experienced that aha moment when suddenly, like Greg had a fellow in our fellowship program the other day, and her name is Becca, and he was having Becca work with a patient who had a lower extremity injury, and the patient was really struggling to connect the lower extremity to the trunk. But Greg took it beyond just connection to the trunk. Greg took it all the way to the head.
Yeah.
And all of a sudden, when Becca felt that, her eyes got so wide and she goes, wow, that was amazing to feel that connection throughout the entire body.
Yes.
And that's what PNF gives you as a clinician. And I encourage people, try it before you discount it as an old method. There's nothing old about PNF. It is timeless.
Yeah. I'm really, really haven't words for how much thankful and grateful I am for your interview, for your talk. It's amazing. It's really amazing. And I really hope and looking forward to see you maybe next year. And I will, yeah. I only can say thank you very much for joining the time. And we are really happy to have you still in our group, and we can be connected. That's so great. Thanks a lot, Vicky and Greg. And
thank you. I just want to say thank you to you and the IPNFA. You're like that torch bearer. You're out there carrying the torch and trying to encourage others to follow in your footsteps, because you have recognized how critically important this approach is to patient care.
yes.
And so it is, I just really want to acknowledge you and the whole organization for what you've done, because very often when a figurehead leaves this planet, sometimes the followers eventually disperse and no longer carry on that vision. And
Right.
you guys have done a fantastic job of making sure that the world doesn't forget. So thank you.
I thank you. Yes,
You're
thank you.
welcome.